NF registry is very, very important to me. I can remember the first time that I started getting involved in the Children's Tumor Foundation, and I can't remember who told me, but the first thing they said is to please register.
So one of the reasons to join the NF registry is you get to hear about all these cool opportunities that are for drug trials or research opportunities.
Your information goes into the registry bank. And not only are they making a difference for you, but they are also making a difference for every single person that has NF.
I think everyone should join the NF registry because, first of all, it doesn't hurt. It doesn't cost you anything. It doesn't take any time. You just get emails that tell you about really cool research opportunities that oftentimes give you benefits, whether that be money or trips to different cities, and you get to be a part of their research and give them data that can help them develop new drugs, that can help you, that can help other patients with NF. Even if you don't really feel like it would help you personally, knowing that it will help someone else with NF and knowing that they could be a part of a trial that could help you, we're all a family, so whatever you do can help someone else just like yourself.
So every single person that's sitting out there that has NF, that is not sure what to do, register, and let's make a difference for NF.
Good morning, everybody. Thank you all so much for being here, and thank you to the Children's Tumor Foundation for having us. My name is Salman Hirani. I'm joined by Dr. Diane Bihal and Dr. Kate Turnage. We're all from Oregon Health and Science University in Portland, Oregon. Our talk today is Whole Person Health, a multidisciplinary approach to pain management. So, I am one of the physicians in the pain group, and I just want to start off by kind of talking about this article in Psychology Today. It's called A Tale of Two Nails. It describes two different scenarios about pain. The first was a 29-year-old gentleman working at a construction site. The construction site worker jumps off of one area onto a plank, and a nail shoots through his boot, and he has severe pain. He gets rushed to the emergency room, and when they take the boot off and they carve through it, they actually realize the nail went through the two toes, like his big toe and his second toe. It actually never touched his skin. It didn't pierce it. It saved, every part of his foot. It was just between the webbing of the toe. So it never actually touched him, but he had severe pain. And so, that is an example of how, not that this person did not have pain, but our brain can process pain in different ways. So his pain was real because of the experience he had gone through. It was such a traumatic experience. His brain was telling him, you have pain. You just had a nail go through your foot, even though the nail didn't actually go through this person's foot. The second example was also a construction worker. It's a very dangerous field to be in. This person was using a nail gun. The nail gun discharged, and the actual gun itself hit him in the face, but he didn't see a nail actually dislodge or anything. He went on about his business. For the next 6 days, he was eating 3 meals a day, going to work, was sleeping just fine. He said he had a mild toothache, so after about a week, he went to the dentist. They got an x-ray, and they saw this large 4-inch nail embedded in his skull. And so this person claimed to have no pain or just some discomfort because they never actually saw the traumatic event take place, which was a nail actually shooting into their face. I like to give these examples because pain is extremely complicated. We don't understand everything about pain. And so one of the things I like to start off by doing is just, telling the definition of pain. What is pain? So pain is described as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. So pain is complex and requires a comprehensive and multidisciplinary approach because there's no one-size-fits-all approach to pain. So that's why we have Dr. B with us and Dr. Turnage with us, because The group that we have at OHSU is extremely multidisciplinary, multimodal. And pain in NF and schwannomatosis is extremely complex as well. So pain in NF, from Johns Hopkins Medicine, they describe that there's intramuscular neurofibromas that grow on small nerves in the muscles, and this can cause some of the pain in NF. And also spinal neurofibromas grow on nerves exiting the spine. These are more common in adults and children, and if they grow large enough, spinal neurofibromas can actually compress on nerves and cause pain, numbness, weakness, neuropathies, radiculopathies. And so there are many different ways that folks in this community can experience pain, and a lot of folks want to know why, and the reason why can be very complex, and a lot of pain doctors or physicians don't know why. But these are some of the thoughts as to why folks will experience different types of pain. And pain can range anywhere between, the numbers are estimated between 20% of the population can experience some form of pain related to NF and schwannomatosis, all the way up to 70%. So it's really important that we take this multidisciplinary approach. And so at OHSU, we have the pain physicians, we have physical therapists, we have nutritionists, we have nursing and care coordinators, we have integrative and complementary alternative medicine, and then we also have pain psychologists that work with us. We, in our group, have 8 adult pain physicians, 8 pain psychologists for the adult population, 2 Rolfing massage therapists, 4 acupuncturists, 2 chiropractors, 4 massage therapists, and then on the pediatric side, we have 5 pediatric pain psychologists, 5 pediatric pain physicians who are anesthesiologists, 2 pediatric nurses who are also care coordinators, and then 2 pediatric physical therapists. And so we have a really large multidisciplinary group that helps us manage pain, not just with any one type of diagnosis, but any pain that gets referred to our clinic. So on my end, I'm going to talk a little bit about the different modalities and treatments that we offer as pain physicians. And so the first is medications. We have 5 different areas, and I'll talk about a 6th that is up and coming. But one is for nerve pain. For nerve pain, which we're talking about, the reason for pain is the growth of neurofibromas within nervous tissue. That can cause numbness, tingling, weakness, burning sensations. And so to help treat nerve pain, the medications that we use are gabapentin, Lyrica, duloxetine, nortriptyline, and alpha-lipoic acid. Duloxetine and nortriptyline are commonly used as antidepressants, and duloxetine we've been using for the past 4 decades to treat both musculoskeletal, meaning muscle, bone, joint pain, but also nerve pain, so the burning, stabbing, shooting, numbness, tingling sorts of pains. Duloxetine can also, because it's an antidepressant, we can also use it for the side effects. We think of it as side effects that are beneficial in terms of it can help with chronic fatigue syndrome, it can help with anxiety, it can help with depression. And so not that it's a silver bullet by any means, but it's a really good medication that is just taken once a day, whereas things like gabapentin or Lyrica have to be taken 2 to 3 times a day to be effective. For muscle, joint, bone pain, our first line is always Tylenol or acetaminophen. Then you have your anti-inflammatories like Advil, Aleve, Celebrex, meloxicam, and then again some duloxetine, and then a natural compound called S-adenosylmethionine. Then we have muscle relaxers. I caution a lot of folks on the use of muscle relaxers because people feel like they have, if you have growths in your muscles, you feel like you have spasm or cramps, folks will frequently get muscle relaxers, but a lot of muscle relaxers are actually brain relaxers. They work on your brain to make you sleepy, and that's how they get the muscle relaxant effect. And so Flexeril, methocarbamol, tizanidine, and baclofen. Tizanidine and baclofen work more on the actual muscles themselves compared to Flexeril and methocarbamol, which are more the brain sort of relaxant, make you sleepy. And then we have ointment medications like lidocaine cream, which is like a numbing medicine. You have camphor, menthol creams, and then capsaicin. And then the last line that we try to use sparingly are opioid pain medications like tramadol, Norco, oxycodone, fentanyl patches, morphine, low-dose methadone, and buprenorphine or Suboxone. In terms of procedures that we will do for patients that have pain, these are minimally invasive procedures or injections like spinal cord stimulator procedures, peripheral nerve stimulation, blocks and ablations, trigger point injections, and then Botox injections for migraines and for spasticity as well. Spinal cord stimulators, it's a device where if you're having burning, stabbing, shooting, numbness, tingling going down into your arms, hands, or in your legs, feet, we will take basically an injection. Instead of injecting medication into the spine, we'll inject 2 electrodes that run up the spinal column and will block pain signals in the spine that are coming from either the legs, feet, or from the arms and hands. But that pain has to be originating from those spinal nerves that we were talking about. The same with peripheral nerve blocks. Instead of putting the electrical lead into the spine, we actually put it at the nerve that's actually causing pain. And so it's a more localized sort of treatment procedure. And then trigger point injections, if you're having just muscle pains or you have very tight fascia muscles, we'll put some lidocaine, bupivacaine, sometimes steroid into a mixture and inject that just very, we don't go too deep, it's very shallow injections and hope that kind of breaks up some of the tissue that's causing a lot of pain and difficulties with range of motion. The others that I didn't mention in the first slide, there's 2 treatments that we have that we don't have that much data about in terms of how they work. One is low-dose naltrexone. Naltrexone is typically used at high doses to help patients get off of alcohol or be able to treat opioid addiction, but there's data that shows that low-dose naltrexone is actually really beneficial for treating pain, both musculoskeletal, so muscle, joint, bone pain, and also nerve pain. Naltrexone acts like an anti-inflammatory medication without being an anti-inflammatory. It acts like an opioid without being an opioid. And we prescribe it at such low doses that the side effects are minimal. The most commonly reported side effect is vivid dreams for about the first week of treatment. And then the second is something called scrambler therapy. Scrambler therapy looks like a TENS unit. It's this big machine that has these sticky pads that you put over the areas where you're having burning, stabbing, shooting, numbness, tingling, pins, needles, electrical sensations. And they use this machine to provide neuromodulation. You don't really feel much with the sticky pads on you, whereas a TENS unit, you might feel some pulsating. You actually don't feel much during scrambler therapy, but after about 5 to 10 sessions for 30 minutes to an hour, most patients feel a significant decrease in those nerve pain sensations. The problem with both of these medications, or both of these different treatments, is that because there's not enough evidence yet, neither is covered by insurance. And so low-dose naltrexone usually costs about $1 a pill. It's taken once a day, so it's about $30 to $40. And you have to get it from a compounding pharmacy. So you can't go to Walgreens or CVS or your local Kroger pharmacy to get that. You'd have to get it from a compounding pharmacy. And scrambler therapy you can find at most academic medical centers around the country and very few private practices because, again, it's not covered by insurance, unfortunately, yet. And then I wanted to talk for a few minutes about digital health therapies. A lot of us may live in healthcare deserts and areas where we may not have access to psychologists that can help treat pain or pain physicians that can help treat pain. And so digital health therapies have been popping up left and right in the musculoskeletal and chronic pain space. And some of those names are listed here. And this diagram kind of shows the extent, in person you have very high touch therapies. You're being seen in person. You can do an in-person physical exam. You can get prescribed medication, but if you need a procedure, you can get a procedure. And on the flip side, you have the virtual care. With some of these, you don't even see a provider. You go through almost a course. And so you learn about how to control pain by reading the different curriculum that they have on how to control pain. And then for others, like Hinge Health, you do virtual physical therapy. Or for Vori, you get a virtual pain doctor and a pain psychologist. And so the same with Override. You get to see and meet with a virtual pain psychologist. And so even if you live in some of these areas where there may not be physical access to care, we're in an age where telehealth is really flourishing, and if you needed access to a pain physician or a pain psychologist, it's more readily available now than it's ever been, and you can connect virtually to the therapist or physician. And so with that, I'll turn it over to my colleague, Dr. B, who is one of our incredible acupuncturists in our pain clinic.
Thank you, Salman. Hi, everyone. I'm so happy you're here today to learn about acupuncture. I just want to do like a mini survey. How many of you have had acupuncture before or know about it? Or, oh, so quite a lot. Okay, okay. So I have too many slides, so I'm gonna, based on what people know and don't know, kind of go through it that way. But all the research in here, there's no conflict of interest. So what is acupuncture? Acupuncture involves the insertion of very fine, solid, stainless steel needles into the skin, soft tissues, and muscles of the body at specific locations with the intention of creating physiologic change within the body. There are many styles of acupuncture. There's a traditional Chinese medicine, Japanese, Korean hand acupuncture, auricular ear, which is just done in the ear, scalp, dry needling, trigger point motor, needling, sports medicine acupuncture, and cosmetic acupuncture. It is a component of traditional Chinese medicine, and traditional Chinese medicine has been in existence for more than 4,000 years. It has its roots in Taoist philosophy, and underneath that umbrella, acupuncture is one of the methods of treatment, but it also includes acupressure, electroacupuncture, which is kind of like hooking up a TENS machine, TENS unit to the acupuncture needles, nutrition, herbal medicine, moxibustion, which is that middle picture with the burning stuff, tuina, which is a form of massage, cupping, which is that bottom picture there, gua sha, which is kind of scraping of the muscles, qigong, and tai chi. So acupuncture really is a whole system medicine, or traditional Chinese medicine is a whole system medicine. And we focus on the prevention of illness and the promotion of health. And as I was going through my education, they kept saying that this was such a tenet of the medicine that 3,000 years ago, doctors in the village would only get paid while you were healthy. And then once you got sick, they would stop paying the doctor until you were healthy again. Because it was an agrarian society. People had to work, they were farmers. So if you couldn't work, you couldn't be productive for your village. So it's a very different concept of how we look at the body. We also look at the body as a self-healing entity, and we focus on the individual, not the disease pathology. So every person who comes into me, and I have an example on headaches in a bit, but we kind of look at you and your constitution, and we also look at all the factors in your life, your environment, your lifestyle, your relationships, nutrition, emotions, and stressors in everyone's life as we're putting together a diagnosis and a pattern of treatment for you. So again, if we focus on the individual, how do we get a diagnosis? So we have a different way of looking at the body. And this little diagram here, since it does come from Taoist philosophy, every organ system in the body corresponds to a season and corresponds to an element, a sound, an emotion. So right now it's summer. That would be the element of fire. That corresponds to the heart, which is paired with the small intestine. And then on here it says triple heater, but I also call it sanjiao, and the pericardium. So this is the season of those organs, and then each system goes through. So fire generates earth, generates metal. So we're always looking at everything in correlation with everything else. So again, how do we come to a diagnosis? I guess it's very easy to say illness stems from imbalance, but then how do you figure out where that disharmony is in someone's system? And so, as I said, I'm going to talk more about headache slides later, because that's a perfect example of you can have many different types of headaches, and I'm going to treat them very differently. And I already talked about the Constitution. So here we go. And this is the part where maybe this is a lot of Chinese theory, so I don't want to bore people. I don't know if, if you've been to your acupuncturists before, but so we look at these very different things. We look at the organ system, which is called Zhangfu. We look at the meridians or energy pathways, which is also called Jingluo, and the 5 substances: Qi, which is your life force; Shui, blood; Zhenye is body fluids; Jing is your essence or constitutional essence that you're born with, and Shen is spirit or mind. And these are the organ systems. And this I'm going to not go too much into, but when you see an acupuncturist and they say you have liver qi stagnation or something like that, it doesn't mean that there's something wrong with your liver or something wrong with your heart. It's the idea of what that does in the Chinese medicine system. I'm not going to read all that, but so just to give an idea that every organ is paired, a solid organ is paired with an emptying organ, and they kind of work synergistically together. You've probably all seen the Acuman. There's 361 points. There's 12 channels for the organs, and there's 8 additional extraordinary channels. So we're using all these points to kind of come to a treatment after we figured out the differentiation. And so, as I said earlier, we always look at everything in correlation to everything else. It's not like yin and yang doesn't mean good or bad. It's a closed system, and if there's too much in one area, then we need to decrease that and even give it back to where it should be. So we're looking at yin and yang, interior, exterior, cold and heat, deficiency, excess. So if you've been to an acupuncture, they may have talked to you about these things, like you have deficiency in this or that. So we're just trying to move that energy around and rebalance your system. So here's my little headache guy. So you see this, I guess, on the left. This is, maybe a 250-pound athlete, more angry, irritable, lots of energy is rising up. We would call that liver qi stagnation. And that kind of headache is more of a pounding, pulsing, ice pick kind of headache. The person in the middle is someone who's getting sick. So maybe when you're starting to get sick, you feel like the back of your neck is achy, your shoulders are achy, you start to have this sort of lightly irritable headache. That's a totally different kind of headache, and I would treat that differently. And then the last image is a menstrual headache. So this person, her headache is more dull and achy, and it worsens with fatigue. So each of those people are going to get a different kind of treatment, even though they all have headache as their chief complaint. So how does acupuncture work? So this is where we get a little science-y. And I need a little water break before we delve into that. So discussing the phenomenon of acupuncture is challenging because I went to school for 4 and then another 2 years to be able to talk about these concepts, which is really difficult to explain to you guys in 5 minutes. So we need to figure out a way to communicate what is happening between the insertion of the needle and the clinical outcome. And our friends in neuroscience and their research has helped give us the language to try and explain what is happening physiologically. The easiest thing to explain is locally when a needle's put in, say you're having low back pain and your back muscles are spasming, you have tight knots, we're inserting them directly into those muscles and into the trigger points, and it's basically increasing circulation. It's resulting in vasodilation, but it's basically increasing circulation in that area. It's also breaking up those muscle knots and reducing inflammation. And this is kind of like the body heals itself. Your circulation's going, those muscles are gonna calm down and relax, the inflammation's gonna move out. So that's sort of the easiest way to think about what's happening. However, a lot of things are going on in the brain, and as Dr. H had said, we're learning about pain is happening in the brain. So we know that acupuncture is doing a lot in the brain, and this is how it's helping decrease pain in the body. So we know that it stimulates the internal release of endorphins, and endorphins are your internal painkillers produced in the brain. They're your feel-good hormones. We know that it increases endorphin 1, beta endorphin, and enkephalin and serotonin levels in the brain. We also know that it modulates the autonomic nervous system. And so when you're in chronic pain, that's basically the fight or flight. That's your sympathetic part of your brain. And I try and tell my patients, if you live with chronic pain, your body over time develops this hypervigilance. You just become overly sensitive to everything because you're in pain all the time. And any little stimulus, since your nervous system is already up here, that little bit more is going to set you over the edge. So what we have found with acupuncture, that it's turning that off and stimulating the part of your brain that's rest, digest, and heal. And it's not immediate, like one treatment is not going to do it. It's a course of treatments, but it's basically retraining your brain to stay in parasympathetic and be able to go there more quickly, helping to modulate that process so you're not, when you are stimulated, you're not going directly to fight or flight. Your body is like, oh, okay, I don't need to freak out. So that's happening over time. There's a network of fascia, so there's no like this acupuncture point corresponds to this nerve, but we are looking at the fascial system, the connective tissue, and along those fascial planes are area of higher concentration of connective tissue and nerve endings, where a lot of the acupuncture points are. But we know that the connective tissue functions as a body-wide signaling, and it does kind of resemble meridians. But they're still working on that. But they think that there is some component that is involved in how acupuncture works. This little one, I'm not going to go too much into, but basically I talked earlier about electroacupuncture, and this research is showing that it does stimulate different neuropeptides to be released at different frequencies. So if someone that you see does acupuncture and does electrostim, usually I'll do it at 2 hertz and 100 U's, kind of cycling back and forth, because it's stimulating those neuropeptides, which is helping your brain just, again, like I said, calm down, go back into parasympathetic. This last image here talks about, or shows, we've done a lot of fMRI studies, and acupuncture is changing the brain. And a lot of it, we know it's activating certain areas and it's turning off certain areas. And a lot of it is turning off the areas of the brain that do respond to pain. So that's also happening. So is acupuncture beneficial for pain? And I would say yes. It can treat chronic and acute pain symptoms. And for most of us in the room, it's more about chronic, but it does help with acute pain. And that way it's sometimes easier to do something that's acute versus chronic. But we always look at the person's underlying constitution that's going into that. And it helps treat all the other side effects that you may have with your chronic pain, like insomnia, anxiety, depression, other issues that are a factor in pain. If we can get you sleeping, that's what I try to tell my patients. If we can help get you back sleeping, a lot of that will go a long way. So I often start there. It is an alternative to opioid pain medications, and this study here was reduced consumption of opioid-like medication by more than 60% following surgery when acupuncture is used. It is cost-effective, and it has very few side effects. We are using needles, and they're puncturing the skin, but they're so tiny. The real side effects are small chance of bleeding or bruising or soreness in the muscles. So now I just want to give a little bit, like, what kinds of things does acupuncture treat? This was a huge meta-analysis done in Australia, and they reviewed 122 conditions. There were 8 conditions that had strong evidence of effect and 38 conditions with moderate effect. The 8 big ones, and I treat these almost every day, allergic rhinitis, basically seasonal allergies, chemotherapy-induced nausea and vomiting, chronic low back pain, headache, tension type and chronic, migraine phalanxis, knee osteoarthritis, post-op nausea and vomiting, and post-op pain. So these are the ones that had the strongest evidence of effect. And this list is various regions, but I also treat all of these, and probably many of you have. I'm not going to read them all out. Or can you see them, or is it too small? Too small, okay. I'll just read through a few then. I know, it's too small for me too. But I know what's on there: anxiety, depression, cancer pain, back pain, constipation, dry eyes, insomnia, hypertension, labor pain, also inducing labor, menstrual hot flashes, menstrual pain, neck pain. I know, I can't read. Terrible, I can't even read it myself. So there are a lot of other things. Pretty much any musculoskeletal issue, I find a lot of times If it's muscle pain, I can treat that effectively with acupuncture. If it has to do more with structural issues, like if someone has stenosis or other like bulging discs, that kind of thing, we can help modulate the pain, but oftentimes you need other interventions like Dr. H does, or ultimately surgery. But sometimes it's enough just to do acupuncture to get the muscles to calm down. But obviously, it's not going to change structural issues. But there's a lot of things that it does treat. And I feel like because side effects are so low, you might as well try it. You know, if you're comfortable trying it. But you might as well try it because before going on to more, you know, substantial things. We also have applications for oncology patients. That's something that we treat a lot of in our clinic. Cancer pain, the fatigue that comes along, as I said earlier, chemotherapy-induced nausea and vomiting, chemotherapy-induced peripheral neuropathy, hot flashes, and wound healing and scar therapy. I treat a lot of post-mastectomy patients whose wounds aren't closing, and we help them through that process. And just lastly, you know, with not just with cancer pain, but with most pain, I'm very lucky to work in the clinic I do, and am able to have colleagues like both of these to bounce ideas off of, and working as a team approach, a collaborative approach, because really, one thing, you know, if pain were easy, we wouldn't have conferences like this. So, you know, being able to treat from many different angles is really helpful. Lastly, I just wanted to give you a little background. I think most people don't know how much education acupuncturist has. The entry-level degree is a master's, and it's either 3 or 4 years. We're starting to move with, I should say, like the minimum is 2,600 hours of didactic and, you know, actual coursework, and another minimum of 700 clinical hours in a clinic treating patients before we're able to graduate and get licensed. We are sort of transitioning to a first professional doctorate. I did do the advanced practice doctorate, which is another 2 years. And we are, and in Oregon, we're licensed by the Oregon Medical Board. And I think, and then just quickly, some states, it's not everywhere, have dry needling, which is usually done by physical therapists or chiropractors. And they don't have as much education. It's usually like a 30 to 50 hour weekend class. Sometimes that's your only option, but just know that they don't have as much hands-on time as a licensed acupuncturist. And then I have some references, which I guess no one can read either, so thank you very much.
All right, and I will close us out on this topic, and it's fun to even hear your presentations as well, because we didn't see each other's slides, but there's going to be a lot of overlap, which is great. So my name is Kate Turnage. I am a pediatric pain psychologist. My training initially was just in pediatrics, so learning behavioral and psychotherapy approaches, working with kids who have chronic illness. But later down the line, my training was actually in pain, and right now, clinically, I see kids through our pediatric pain clinic, so they're presenting with lots of different pain concerns, but the majority of my time is now actually spent treating kids with different headache disorders as well. So I just wanted to start with two things that are pretty common things I hear the first time I'm meeting someone in my clinic, especially a kid, is that they have at times felt dismissed or invalidated about their pain. It's been going on for a very long time. They feel pretty frustrated, and have somewhere down the line heard from someone, whether it was a teacher or a friend or even a physician, often a physician, no offense, that they have felt like the pain, they must be making it up or it's not real. And so we do spend some time talking about absolutely not. All pain is real all of the time, and I know my colleagues up here would agree with that. And the definition that my colleagues also shared is there was a recent change to it to include the emotional component. The way pain is processed in the brain is physical and emotional 100% of the time. So often when I'm meeting with someone, we're talking about those things first and really kind of validating their experience of managing and dealing with something that other people cannot see often, and it can be really challenging. Other people think they were referred to a pain psychologist because they must be anxious or depressed, and not to say that they might also be experiencing anxiety and depression, but that's not exactly what the crux of pain psychology is. And so we've all spoken about this just in kind of different ways, which is really interesting. But pain, what we know now is that it is biopsychosocial. So way back in the day, we used to think that pain was a direct result of tissue damage. But what we know now is it's a much more complicated process, and it has to do with your biology, your genetics, your physical health, your psychology, how you cope with things, your mood, your stress, right? And then your environment, your household, your culture, your socioeconomic status. There are all of these things, and they are interacting together to form pain perception in the brain. So why would your provider send you to a pain psychologist? There's lots of different reasons, but I do try to focus not so much on just eliminating pain, because when I meet with kids and I say, what is your number one goal for being in my office? I want you to make my pain go away. And that would be amazing, right? And we do actually have some incredible evidence for behavioral and psychological therapies for reducing pain intensity, reducing pain frequency, but really it goes much beyond that. So I see kids who are dealing with acute pain, so I'll get consulted to go into the hospital and maybe see someone post-surgery to help manage, find some behavioral strategies to manage pain and wean off of medications. But oftentimes I'm seeing kids for chronic pain. So they've been dealing with chronic illness or chronic pain for a very long time, and there is an impact on the quality of their life. And so one of our primary jobs in that situation is really to help them cope with dealing with something that they have been struggling to deal with for a long time. So can we just improve their daily living? Reducing pain-related disability, so how impactful is pain on your functioning? What is it getting in the way of? Is it getting in the way of work or school or mood or sleep? And can we work to try to improve those areas of your life really specifically? And then oftentimes we actually can improve pain kind of as an adjunct effect to that. Managing stress and anxiety. Pain is an unpleasant sensory experience. It is inherently stressful. So can we learn ways to kind of cope with the stress and decrease that part of your nervous system that is kind of in that chronic firing state and bring it back down a little bit? And then the emotional functioning. We know that with chronic pain, there are higher rates of anxiety and depression, and in chronic illness as well. So can we concurrently treat those things too, knowing that that also impacts pain perception? So I just put a couple of the treatment modalities that psychologists use when treating chronic pain. Cognitive behavioral therapy, that's the most commonly researched and the most proven psychological intervention for the management of pain, pediatric and adult. But there's also acceptance and commitment therapy that has kind of come out of cognitive behavioral therapy. And the shift is a little bit different. It's less about changing thoughts and more about having some acceptance around how things are, and can we kind of move forward and cope with that so that we can get the most out of our life, even in the context of our situation. Pain psychologists sometimes also use biofeedback, so that is usually involving some sort of device. So technically, like an Apple Watch is biofeedback. It's giving you feedback or information about some physiological property that's happening in your body, like heart rate. So this is often paired with learning relaxation exercises. So can we practice relaxation and actually look at how it is impacting your physical body? And then mindfulness-based stress reduction. So I include these on here too for if you decide to look for a pain psychologist or a psychologist to help with chronic illness or pain management. I would look for these type of modalities as the treatment approaches. These are just a couple of options because, as we've already mentioned, it can be kind of hard to find specialists depending on where you live. It's hard to find a mental health provider, let alone a pain psychologist. So do not be afraid. There are other options. The telehealth move and the access to virtual psychotherapy and phone mobile apps that exist that provide cognitive behavioral therapy is booming. This little infographic on the top left, that's an app that we recommend all the time called Web Map Mobile. It's for pediatric patients who have chronic pain. It was developed in Seattle, and it's a really great cognitive behavioral therapy for pain app. The image on the right, that's the Comfortability Workshop. That is a pain, it's a group treatment for kids and their parents to help learn CBT-based strategies for managing pain, and we do it virtually, and we do it at all hospitals all over the nation. So you can look to see if it's offered at a hospital near you, and if it's not, their website also has incredible resources, and you might be able to participate out of state as well. And then the books that I put on the bottom, I actually brought with me today too. So if anybody has interest in kind of leafing through these, just grab me and I can show you. But these are books that I typically recommend to parents on how to help kids with managing their chronic pain. We know that parenting in general is not intuitive, but parenting an adolescent or a kid who's managing something as challenging as pain that has become persistent is really, really not intuitive and can be really challenging. And so these books can be great tools and resources. And then the book on the right is actually a book for teenagers themselves to kind of self-navigate some of these psychology principles for managing pain. And so last, I just wanted to end by saying sometimes the way we phrase it in our clinic is that the treatment of pain really needs to be multimodal. You need to have lots of different types of providers kind of working on different things because it is not directly, purely biological like we once thought. And so it's kind of like you have 4 tires, and maybe we fill one tire with medication-based approaches or recommendations from the physician. Maybe we fill one tire with acupuncture. Maybe we fill one tire with, something else that works for you, like physical therapy or aromatherapy or whatever the case is. And maybe the 4th tire is, a psychologist or whatever. And it takes time to figure out what those 4 tires are. And that's really kind of how we think of working together to treat a whole body, a whole person when they're struggling with something like pain. And that's it. Thank you.
I was going to say, Lauren, you have the mic, so if anybody has questions, we'd love to.
So my question is kind of a double-fold. The idea of acupuncture sounds really interesting to me because I practice herbal therapy and I use essential oils mixed with Epsom salts for baths. That has been hugely helpful with managing my chronic pain.
Yeah.
But I know that any injury to the skin can cause new neurofibromatosis to grow. How does that correlate with the using of needles? Even though they're super fine, I know they're way fine.
Yeah.
How does that correlate with not making more neurofibromatosis grow,
Exactly.
which are on nerve endings, which
Exactly.
cause more pain?
Exactly. Do you have an answer? No, I don't. I really don't have an answer for that, and I'm sorry that I don't. I'm wondering, there are other forms that, like with acupressure, there's also more pediatric style where they use a tation, so it's almost like a metal rod that's slightly thicker than an acupuncture needle, but they'll just hold it over the points. And so I think that would be what I would want to try first to see, instead of trying to insert needles, since there is that risk. But there are, I guess, other ways around it. Not everyone does that, though. So you would have to find someone who did more of a pediatric style with a tation or acupressure. And there are like shiatsu massage therapists and other, in the Chinese version is Tui Na, where they kind of incorporate using the same points, and that may be a way to go as well.
I have two questions kind of double folded as well. One is on the acupuncture, similar to the last session where we live, we have very limited access. How do we go about finding somebody that is at your level? And then my second question is, again, because we have limited area, what is your suggestion for those of us that occasionally have to, say, visit the ER for acute pain, and it's traveling doctors, nobody really knows you, and everybody thinks you're drug seeking? How do you suggest we approach that to combat that accusation and get the treatment we need?
I'll do the first one, yeah, and he'll do the second one. What there is, and I can, afterwards, I'll get my phone and look it up. There's the National Certification Commission for Acupuncture. They're based in, I think, DC again, but they do have, you can go on their website and look for people that have been certified through, it's the NCCAOM. What state are you in? Wyoming, okay, yeah, so there are less providers there, and so there are some, like, sometimes there are forums where I look for people, but I would look for at the NCCAOM first, and I can give you that information afterwards.
And then to answer the other part of the question, I think that's where a lot of the digital health and virtual options that are just fully virtual, right? You can now access a pain doctor as well as a pain psychologist just completely virtually. And the way a lot of these startup companies and telehealth companies operate, they make sure that each of the providers that's on the application is licensed in almost every state, right? And so you can have that experience where you're like, I have a pain doctor. You know, you could literally show the app, and they have 24/7 availability, right? So if you're having an acute pain crisis, right, you could also message your provider on the app. They could provide guidance. You could still go to the ER, but then show that you have a pain management provider who's managing this, and they recommended that you go to the emergency room. And so that way, you know, there's I think that things because the opioid epidemic have swung so far out of control in terms of putting patients at a disadvantage to where every single patient that's in acute pain is seen as drug seeking when there's pain that can't be managed with Tylenol and Advil, right? There is a place for opioids, right? And unfortunately, patients are having to advocate for themselves instead of their providers advocating for them. And so the landscape has changed a little too far to be so protective of addiction that we're not doing a good job of treating acute pain. And one of the leading causes of chronic pain is untreated acute pain. And so, we want to make sure that we are advocating for ourselves as patients, but then that we're also getting our providers to advocate for us as well. That's a great question, yeah.
This doesn't have to do with my question, but with the pain management, I do have a pain management doctor, and you do have to go in every 30 days, and you're randomly drug tested to make sure you're not getting medications from other sources, but they do monitor you if you actually have a pain management doctor that you go to.
So the pre-COVID, so the rules around that are different state to state,
Yeah.
right? And so at the federal level, if you take a look, there's not this necessary requirement for every 30-day urine drug screen, right? Especially once you establish care consistently with a provider, you'll see that maybe the first time they get a urine drug screen, right? But then after that, they may decide to do it every 3 months, and then go every 6 months, and then go every year, right? In Texas, it's a requirement that you almost get it nearly every single month because they want to make sure that you're not, if you're taking any sort of opioid, you have the right to opioid pain management, but if you have THC, if you have marijuana or any other drug in your system, automatically you can't have
Yes.
an opioid pain medication, right?
Yeah, that's how
Whereas
mine is
in
in Colorado.
Oregon,
Yeah.
in Oregon, where, you know, it's rare to find a patient that doesn't have CBD or THC in their system. Every single patient is already on marijuana, it feels like. And, you know, but we don't take patients off of opioids just because they're on, you know, they're taking some form of marijuana. But we do counsel, like, there's a lot that we don't know about the interactions between, you know, cannabinoids and opioids, right? And so it's a state-by-state thing where a lot of states don't require that, and especially with the telehealth rules and
That's why I
restrictions.
was curious for her
Yeah.
with the telehealth.
So the Ryan Haight Act, there was exceptions. Ryan Haight was this law that was put into place to prevent illicit prescribing of opioids over the internet. It's a law that was very, very old, and wasn't meant for today's, you know, completely connected world. And so during the pandemic, you had DEA and HHS putting basically a pause on a lot of those requirements, and you can see a provider completely virtually, and they can prescribe to you without having to have done a physical exam in person. They can do a physical exam virtually, right? If you do a telephone visit, that's where it gets tricky because they can't do a physical exam over a telephone call. And so virtual physical exams are allowed. Now, the public health emergency just ended last month, right? And so the DEA was going to roll back those rules and require patients, if they had not seen a provider in person for a physical exam, you had to go just once for an in-person physical exam, and then you could continue getting prescribed opioids virtually permanently thereafter. But they got so much pushback from that that they decided to hold off on that. And so you still don't have to go see a person, a provider in person physically. You can still do virtual care and still be prescribed opioids if your provider feels that that's what's best for you.
And my other question was about the acupuncture. I was told at one point that people with NF should not have dry needling. Have you ever heard that, and why?
I think that goes to the same point, is that creating trauma, skin trauma, right? Or if needles penetrate too deeply, you can have new neurofibromas that grow out of that, right? But not every patient has that experience, because we still will offer a lot of the procedures that I do compared to what Diane does. We're using like 3 and 5 inch needles in order to get to deep-seated spine tissues, right? It's a risk that we just tell the patient that they have to be aware of, right? So it's possible that you may get, you know, these microtraumas cause additional neurofibromas, but it doesn't happen for every single patient. And so you have to balance, you have to weigh the risks of that happening versus the amount of pain that you're in that a procedure could potentially provide.
Yeah, and I just heard that with the dry needling, not actually with the
Yeah.
acupuncture.
And so, you know, there's also different styles of acupuncture too. And so I'm wondering if seeing someone who uses much smaller gauge needle, I mean, some of the ones I use are 0.40. Is that? I know, this is the Japanese system too. I use a lot of Japanese needles that are very, very fine, and they don't have to be inserted very deeply. Dry needling, like that last slide I talked about, it's been sort of, that term has been taken over by physical therapists and chiropractors who are using it, and they are trying to go deeply into the muscles, and they do a lot of strong stimulation. There's a kind of, the more Japanese style acupuncture, and actually, what I do now in the chronic pain clinic is much more superficial, much more gentle, and I'm wondering if it's not as traumatic to the system, that it wouldn't cause. So, you know, they are really fine, and there's a way to insert them in a way that's not gonna, I don't want to say be more dramatic, but a lot of the dry needling is like dramatic, and they're really trying to get a strong muscle reaction, and there's a way to needle that doesn't do that. So I would also want to look for a person like that and really make sure they understand about NF before they, before you let them start treating you. However, I would also, and I can look this up and maybe give it to whoever to give to you guys afterwards, the concept of like the tation and just sort of holding it over points, and that's somewhere to start. I did also remember we do ear seeds on people where we'll leave in, there are some that are tacks, but that would probably be a bad idea, just with they're seeds on a piece of tape basically, and then you leave them in the ear and then you self-stimulate in your ear, because the ear is also its own little microcosm of the whole body, so you can do treatments just with that. So there are other ways around it, it's just whether or not your acupuncturist has studied those other things. And unfortunately, I'm a chronic pain patient myself. A lot of this is you doing your own research and talking to people and meeting people and finding out who works best with you. And it's unfortunate, but we all have to advocate for ourselves. It's hard to advocate for yourself when you're not feeling well. So, but hopefully that answers your question. It's not simple, but I feel like if you found someone that was willing to work with you, you could figure out a way. That's my answer. Yeah.
Okay, so we're actually out of time, unfortunately. But put your questions in the Whova app, and we will get them answered for you guys, okay? Thank you.
Thank you so
very
much, everybody. Appreciate it.
Thanks.